Oi, gente! Dando continuidade ao nosso Junho Verde, na live de hoje eu vou conversar com o Michele Romano, o desenvolvedor da abordagem CIAS. Então, para quem tá chegando aí, eu imagino que esteja todo mundo super ansioso para ver o que que vai rolar. Ai, a minha tradutora chegou, graças a Deus. Oi, Grazi, que bom que tu tá aí. Aleluia! Gente, olha só, hoje a live vai ser toda em inglês. É, eu não sou uma super faladora de inglês, então eu vou ter tanta dificuldade quanto vocês. Eu vou me esforçar ao máximo, eu vou fazer o meu melhor. Quem sabe inglês, manja de inglês, por favor, mande suas perguntas já em inglês, que isso vai ajudar bastante. Mas quem não souber, não tem problema, porque eu tô aqui para mostrar para vocês que é possível se comunicar, mesmo com algumas falhas, né, alguns errinhos gramaticais, mas o importante é a gente se entender. Então, mandem suas perguntas, por favor, não deixem de perguntar. Quem puder mandar em inglês direto, manda. Quem não conseguir, manda em português, tá valendo também. Só as perguntas em português, eu vou me esforçar para traduzir para o inglês e vou fazer as perguntas daí diretamente para ele, tá? Eu vou me esforçar. Oi, Annelise, tudo bem? Sejam bem-vindos. Eu prometo que eu vou me esforçar muito para que seja muito proveitosa essa live para todo mundo. Então hoje eu vou falar com o Michele, para quem tá chegando, ele já tá por aí. A gente fez vários ensaios e finalmente deu certo, então vamos rezar para correr tudo bem agora. Para correr tudo bem agora também. Ele chegando. Atenção. Tchau, Michele!
Ciao, Isis. Hello, dear friends. Ciao. Ciao.
How are you?
I'm very fine. And you? And what is
I'm
the
fine.
weather? Yeah, what is the weather in Brazil?
It's a little cold today.
Mm.
In the morning was 8 degrees Celsius. 8.
Okay, it's not my previous experience in Brazil. Normally,
Yeah.
yes, there is always very, very cold time, very, very cold weather. Very, very hot weather.
Hot, yes,
Yeah.
because you went to the Rio de Janeiro, but here in the south, in the winter, it's really cold.
Yes, I know. Yes, I know.
So we have some audience at this moment, and we have a lot of fans and students waiting just to listen what do you have to say.
Mm-hmm.
And I would like to start introducing you. So
Yeah.
I will speak a little bit in Portuguese,
Obviously.
and after that, I will return to English.
Yeah.
And I already said to our audience that English is not my native language, so
Yes.
I apologize for my English, but what really matters is to communicate. So let's talk about scoliosis and talk about SOSORT, okay?
Okay, very, very good. And all the audience, I think, know that also my original language is not English.
Yeah. Yes.
Yes, I must use English, but this is not my favorite language.
Okay. Yeah. We can practice Italian, and next week we can do this conversation in Italian, maybe. I can study.
Yes, it's a very good idea. Yeah.
Okay, Michele, thank you so much for sharing your knowledge with us, to be here, sharing your time. So I am really glad that you are here, and I say thank you.
Thank you very much, Isis. I am very, very happy to stay some minutes with you. I don't know, 40 minutes? Will be 40 minutes, 50 minutes?
1 hour.
1 hour, yes.
Okay.
Will be very nice, I think.
Okay.
Okay.
Gente, então, para quem não conhece, esse é o Michele Romano. Ele é fisioterapeuta, como eu e como muitos espectadores aí. Que orgulho de ser fisioterapeuta. Ele é diretor nacional da fisioterapia do ISICO. O ISICO é um instituto científico italiano da coluna vertebral. E existe ISICO pela Itália inteira, mas a sede é em Milão. Eu fui lá visitar em janeiro, fevereiro agora desse ano. O Michele é professor de cursos nacionais e internacionais desde 1997, é mestre em ciências da reabilitação, ele é ex-presidente da SOSORT e autor e coautor de diversos artigos científicos na área da escoliose. Além disso, como eu já citei aqui, ele é o desenvolvedor, né? Então, o grande pensador da abordagem CIAS e também o autor do artigo que comunicou para toda a comunidade científica o que é o CIAS e como ele funciona. Então, a gente vai poder ter a oportunidade de ouvir hoje diretamente do pensador, do criador dessa abordagem. Então, já vão preparando as perguntas aí. Oi, Lucas. Oi, Fernando. A todo mundo entrando. Estou muito feliz. Que bom que vocês estão aqui. We have some physicians watching our conversation, and the teamwork is really important for the success of the treatment of scoliotic patients. So I'm happy to see them.
Yes, me too.
Okay, so I already introduced you. I speak in Portuguese, so maybe you don't understand, but...
No, it was really easy. It was easy.
Really?
Yeah.
Okay. I try to speak slowly, so maybe you can understand. So I will start to do some few questions, and maybe we have other questions from the audience, and I will translate it to you.
Yeah.
And just let's have a conversation, okay?
Yes.
Okay. So, Michele, the International Society on Scoliosis, Orthopedic and Rehabilitation Treatment, that called SOSORT, is one of the main international organizations concerning with scoliosis. And you were a president of SOSORT, so you really know how does it work. So could you explain further about SOSORT and how it works?
Yes, I try to explain. SOSORT is not one of the main important, is the main important international.
Yes.
Because it's very, very focused on this specific scoliosis, but also SOSORT considers type of misalignment. Not only the three-dimensional misalignment, but also the misalignment in the sagittal plane. This is another word close to scoliosis, and SOSORT started to study and to increase the ability to treat the patient, also for this type of patient. The new very important word will be the treatment of the adult patient, because until now the scoliosis was always considered a pathology linked to the adolescent age. Now we know that it is not true. The scoliosis is more close to the adolescent and the young peoples, because typically the scoliosis starts in this moment of our growth. But now we know that scoliosis is the real problem, will be the problem in the adult age, will be not the problem in the adolescent. So the new very important topic for the evolution of the treatment will be this new way. So SOSORT was born 17 years ago. I was one of the founders of SOSORT. It was for me, it was a really opportunity. I was a lucky physiotherapist, because SOSORT was born in Europe here, and I had the possibility to start by the very first Congress, and then all the other Congress. Until now, SOSORT organized every year a Congress, a meeting in different countries. Normally there is two Congress in Europe and one Congress in USA. But now the board of SOSORT decided to also to consider other continents, not only North USA and Canada and Europe, but also other continents. So I think the next meeting will be also in the South America and also in Asia. I don't know if you know, obviously, but I don't know if all the audience know that the Congress of this year was planned to organize in Melbourne, in Australia. Yes. And it was impossible, the organization of this meeting, due to the before
COVID-19.
Yes, and so this is a very sad year this year, because it was possible the organization of this meeting, but we are projected on the next meeting will be in Europe, will be in Spain.
Yes.
SOSORT is a multidisciplinary society. It means that in SOSORT there are physicians, obviously, there are many physical therapists, there are surgeons, there are orthotists, I mean the people that work to prepare the braces, and in SOSORT there are also some patients that are in the society to be the representative of the patients. And very important aim of SOSORT is to spread all the knowledges of all the people, all the specialists from many countries. In SOSORT, there are members, they come from more than 50 different countries. So it's a very big society. And the aim of the society is to spread the knowledges of all these people, and also to create more and more the connection among the physician, the physical therapist, and the orthotist, and the scientist, to have a big group of people with a different ability, different knowledges, to obtain the best possible treatment for the patient in the future. I know that now the treatment that we can offer to our patient is not the best. The treatment that we can offer is the best possible, considering our knowledges. We know that this is not the best. We know, I am sure, that in the future the treatment will be different, because the knowledges will improve, and also all the discussion about between all the different specialists will increase the specific ability of the different specialists. The physical therapist will help the physician, and the physician will help the physical therapist. And I am very confident about the future. I am sure that it will be impossible for me to see the final solution of scoliosis, because I am too old. So it will be impossible for me. But for you, it may be for the young people that this evening, now this evening for me, sorry, it's not evening for you, is
Almost evening.
late afternoon, okay? And I am very confident about the increasing of this. And also I am very confident because the young people that I know, that I had the chance to know all over the world, and you are one of these. And I am very confident because I know that you and the people that you know, and the other young physical therapists and the young physician will increase more and more the techniques that now we use. So before my die, I hope I hope to see you to take place of the old and to increase more and more.
Okay, we are working on that.
Yes, I know. Yes, I know. I don't know if you have some specific question about SOSORT because maybe I forget, because in my mind it's clear, but I don't know exactly what is the most important elements to offer.
No, this is important. You cited a very important topic, that SOSORT is a multidisciplinary organization or society. And this is different from SRS, for example, because in the SRS, you just have surgeons or physicians. You do not have physiotherapists.
Yes. One of the example, for example, is the president in SOSORT. Before my opportunity to be the president, all the previous president was a physician. All the previous. I was the first physical therapist. I am very proud about this. And,
me too.
And now the president is a physical therapist, but the previous president was an orthotist, so is another specialty in the scoliosis field. So this is one of the example of what is SOSORT. SOSORT is a very friendly group, is a big group, a very friendly group, and there is the possibility to increase our ability in all the different fields, and to increase to increase the ability of all the group.
Yes, of course, because when we have discussion, when you think together, it's better for our patient. That's what really matters when we are treating somebody else.
Yeah.
So could you talk about how relevant is SOSORT in the treatment of scoliosis nowadays, thinking in the scientific evidence, and maybe you can talk about the guidelines?
Yeah, obviously. One of the aim of SOSORT is the production of guidelines. The guidelines is a very important document because is the sum of all the scientific evidence that we can collect until now. The collection of this scientific evidence sometimes is difficult because it's a very hard work. It's necessary to read many papers. It's necessary to be able to decide what are the most important, because the papers are too much. So it's necessary to be able to identify the good papers. And so collect all the good papers and obtain the sum of the suggestion of all the scientists that prepared these papers. The guidelines is the sum of this evidence, and these evidence are explained in a very systematic way. It means reading the guidelines, I can understand what is the most important, relevant, and the most important evidence about, for example, the assessment of the patient. So I know that all over the world, the paper can teach us how to do and how to don't perform, because sometimes in many countries the techniques are very different, and sometimes some of these techniques are not based on evidence, are based on the idea, theoretical idea. And this is a very big problem, because if we use this type of strange idea, because sometimes are very strange idea, and in many countries, many peoples are treated following these strange ideas of the assessment, strange ideas of the exercise technique, strange idea about the braces, strange idea about the surgery, about the necessity to take the way of the surgical intervention. The guidelines give us the opportunity to read the sum of the most important knowledges to know. So it's a big document. It's a very long document, because the papers are very a huge number of papers. But many people in SOSORT worked to identify the most important and to describe only the evidence of the best possible treatment. This document is a free document. It means all people can download, can read. The problem is it is in English. I'm sorry. Also for me, in the past, it was always a problem, because when I was not really able to speak or to understand the English, it was a very limit. It was a very limit. And now I know that my English is not very big, very beautiful English. I use a poor English. But even if my ability to use this language is not a big ability, it's enough to understand, and it is enough to talk. And now with technology, I think we can also we can use helps for the traduction of the papers. So now it is not impossible to read this paper. There is some helps to do this, and this is important, because if we don't start to read this document, it will be impossible to understand the real good way to treat our patient.
Perfect.
Yeah. This
document.
This is free. It is free. It is possible to download. And my very suggestion for all people, for all the audience, this almost evening in Brazil, is to find this document, to download and to read. And then
it's very easy to find. Yeah,
it's very easy. And then if they want to ask me questions, they can. Not this evening, because it will be impossible, but in the future, if they want, they can write to me.
Yes, perfect. And it's important to talk that this document can guide the physiotherapist or should guide physiotherapist, orthotist, physician,
Yeah.
and the patient. So the patients can read and the patients can know if the professionals that are treating them are doing a very good job, a serious job based on evidence.
Yes, yes. This is one of the most important elements of the guidelines. The guidelines is free, so all the people can read. So if we don't follow the guidelines and we decide to use a strange, in my concept is a strange technique. Maybe is a good technique, but until now, before the study, before the possibility to show that these new techniques are really evident,
Mhm.
it's always strange for me. And the people, the patients, can read these documents and can understand what is the ability and what is the if the professional is serious, is the professional is serious or not.
Yes, yes, of course.
Yeah,
And at this moment, I am a member of SOSORT because I went to the last Congress in
yeah,
USA
yeah.
and I really follow the recommendations. I treat my patients with scoliosis specific exercises, but maybe our audience they don't know how to become a member. So how can health professionals become a member of SOSORT and explain a little, is it a complicated process?
Is not complicated. Is it's necessary to ask the support of at least two members of SOSORT. It means if I want to be a new members, I must to search, I must to identify other members. I have to ask if the members would like to support me. The task for the members that want to support the new member is to understand who is this new member. So the task of the active member is to uh, understand if the new member, the new potential member, is a serious professional or not. This will be the first task. Identify two members to be supported. Then there is a form to fill and to send to the organization, to the secretary. And then one of the other mandatory element is the participation in the meeting, because during the meeting will be possible to start the to start in English to know all, not all that people, because there are many peoples, but to start the connection with some of the members. Typically,
Yes.
in this meeting, the new members will start to stay sitting close to the people of the same country. Obviously,
Mm-hmm.
it will be
Mm-hmm.
easy. Yes, will be easy
Mm-hmm.
start the connection, and then the connection will be more and more ample and more big, and will be possible to know all the other people of all the continents and start to understand what's happened in the other continents and the other countries, and our mind will be more and more open. Will be possible to understand that our ability, our knowledges. When we start, normally is our poor knowledges. So we need to open our mind and to understand and to discuss with the other people. And a society like SOSORT is one of the big opportunity for this, because only reading the paper, it is almost impossible to really understand what happened all over the world. Only reading is difficult to identify the paper to read, and sometimes it's difficult also to understand what is done in the paper. Sometimes it's very important to know the authors and to talk about the authors.
Yes. Yes. And how can we know if a professional is a SOSORT member? You have a way to verify if, for example, we have some parents in our audience, and
Yeah.
maybe they are concerned. How can they discover?
I'm sorry, Isis, there was a little difficulty in the connection. Could you repeat your question?
Yes, yes. How can the parents or the patients know if the professional with which they are be treating are the SOSORT member?
In which ways? There is a list in the society, a list of the members of SOSORT. It is possible to ask to the society, and normally the people, the members of SOSORT, has also a paper. Typically, they
Okay.
have it.
Okay,
Yes.
okay. So it's easy to know if the professional that are treating your child or your adolescent is a SOSORT member, and this is not mandatory. You don't need to be member to follow the recommendation, but when you are a member, you participate of the Congress and the meeting, and this is really good.
Typically the SOSORT members must to follow recommendation. Also in this case is not mandatory, but it is really normal. All the SOSORT members follow the recommendation of the guidelines. Even the professional, the no members, but professional treating patient, also these people can use the recommendation and can follow the recommendation. It is obviously the recommendation is not only for SOSORT members, is for all people that love to use the evidence. Sorry.
Yes, this is really important.
Yeah.
So it is important to know about SOSORT. It is important to read the guidelines, and for the professionals, for the practitioners, it is important to follow the guidelines. It's not just read, you have to follow the guidelines. This is important too.
Yeah, the guidelines change over time. It means the guidelines is not the Bible. Guidelines is it changed. The last version of guidelines is 2016, and it is the new version. And I think in 2 years will be necessary to update these guidelines, because the scientific literature change our knowledges, and the guidelines must to be really close to the new also to the new evidence. So the guidelines must to be the last guidelines, not the guidelines. Must to be.
Yes, yes.
To follow
Yes,
must to be.
it's important.
Yeah, yeah, yes.
Okay. And could you talk, thinking in the Scoliosis Awareness Month, that is June, and in all over the world, could you talk about the importance of actions in order to promoting the scoliosis awareness? Why we need this type of conversation or events or maybe lectures? Why do we need this?
Why we need? But first, because scoliosis is a pathology that not all the professional treating scoliosis have has enough knowledge. It means also in Italy, for example, many physical therapists treat scoliosis patients without big knowledges. So it is really important that all the professional treating the patients, starting by the physician, because also in the group of the physician, sometimes there are some of these professionals not really able to treat this type of patients, because scoliosis is a very complex pathology. It is not like the fracture.
Yes,
Is a
absolutely.
very complex pathology, and it is very difficult the good treatment of this patient, because without enough knowledge, it's impossible to identify the good tool for the treatment of the specific patients, because the tools, the different tools are different, and the choice of the tool is directly linked to the specific patient. We cannot use the same technique, the same tool, the same brace for all patients. We have to identify the good treatment for the single patient. Sometimes, for scoliosis, for example, one of the big mistake can be to use a bigger one of tool, treating a patient with the no severe scoliosis, or sometimes the treatment of very severe scoliosis using a no useful tool. So one of the knowledges is the ability to identify the good tool for the specific patient, and this is possible to be able to do this only if the professional will treat many patients and read many papers and understand many things. It's very important, it's necessary, it's mandatory, the experience. It's mandatory experience. And how we can increase our experience? First, reading. Second, talking. Third, treating. Only following these different steps, we can increase our ability to move ourselves in the big, difficult scoliosis field. And these events, for example, is one of the possibility. Is one of the possibility to explain. Is a possibility to start in the mind of our audience the necessity to increase the knowledge. Maybe after the discussion, some of the people will ask ourselves, maybe I need I need to read a little bit more, or to inform me a little bit more, because maybe I have no enough tools to use.
Yes.
So the evidence is important, and the society like SOSORT is important, because this type of society is an opportunity, is an element that can push the people in the good direction. Society, the sort of try to push the people in the good direction. The people, it means the professional, and also the family, also the parent. Yeah.
Yes, of course. It is really important. Could you tell us, curiosity, could you tell us one amazing action that you have seen around the world? Because you travel a lot, so you have contact with professionals in many countries. So tell us one amazing action that you have seen.
I think, yes, I have the big, I am a lucky man, the big chance to travel in many different countries. I think the more amazing element for me was when I went many times in different Asian countries. I was in China many times. I was in Korea other times, in Malaysia, and the possibility to see the local knowledges, and also the different techniques that normally I don't use, like the acupuncture, for example. Do you know that there are some countries where the acupuncture is used, obviously, and there are also the idea that we can use this type of technique for the treatment of scoliosis. We know that is not useful. We know because there are no paper that show us the possibility to treat our patient using this technique. But there are some countries, some cities where professional like physical therapists use this type of technique. Or also, for example, for me, strange manual techniques. Until now, we know that the manual technique for the treatment of scoliosis patient is not really useful. There are some papers about the effectiveness of the manual therapy, and even if we know that the manual therapy until now don't work, because the technique that now we can use don't work on our patient. There are many countries where the manual therapy are used, not only in the Asia, but also in USA, for example, or in other Western country. Also for this, I was different time in USA, and I was also invited in specific meeting organized by Society of Chiropractor or other professional using this type of technique. And invitation for me was based on this. You, Michele, you use exercises, specific exercises. Could you explain us why the manual techniques don't work? And my answer was, because don't work. Because there are no papers. Because we treat your patient using these techniques, but until now, there was not possible to see one patient better after the treatment, in better condition, considering obviously the misalignment, not other problems, not the back pain or the neck pain, but the misalignment of the spine. It means until now, for example, this type of technique is not. This is not amazing. I mean, your question was about the amazing. This is not amazing.
Yes.
because I seen too many patients treat in using this technique, and this technique don't work. In very another amazing, but also it is not amazing, but was amazing. For example, in Russia, I was several times in Russia, and also in Russia, the knowledges are very poor, considering the scientific literature. And I had the possibility to see different patients treated in some hospitals, some public hospitals, using a very old techniques that in the West Europe we don't use now. For example, I don't know. Do you know what is the paraffinotherapy?
Yes.
Paraffinotherapy, yes. In my country, in Italy, was a technique used 50 years ago. 50 years ago for the treatment of some pain problems in some articulation. And last year, I was in Russia, in a country where in the public hospital, the typical treatment for scoliosis patient was the application of paraffinotherapy on the spine. And it is not amazing, but
No.
it's not amazing for the patient. It's not amazing for the parent. For me, it was a very sad moment.
Of course.
Yeah.
Yeah, I never saw this type of treatment. I just heard about it in the graduation when I was studying physiotherapy, but this is it's not very often used technique. So
This type of technique. This type.
yes.
Yeah.
Yeah, this type,
Yeah.
paraffinotherapy.
For example, in another country, I want to be polite. In another country, one of the typical technique was to ask the patient to lie in the bed for many months in the bed. So,
Okay.
live in the bed, read in the bed, study in the bed, eat in the bed, never wake up, never stay in standing, because the idea was the gravitational force will push the spine and will increase the curve. So the best possible treatment is to delete the gravitational force. In which way? Asking the young people to stay in the bed. This is only this is really not amazing. Is
No.
yeah, it's amazing to see, but it is very difficult to accept.
Yes, of course. This is terrible. This is
For
terrible.
for this reason, a society like SOSORT or an event like this is very important, because using our discussion, we try to explain what is the bad. But
Yes, of
the
course.
idea is the same. Why is bad and why is good? there is no theoretical elements, because theoretically, the reduction of the gravitational force is a good idea.
Mm-hmm.
Theoretically, yes. The problem is that we know that even when we delete the gravitational force, the scoliosis increase. So the problem is not gravitational force. So the theory is a way, but most important is to understand is the result. And this is possible only organizing scientific trials.
Yes.
Only in this way it is possible to understand if the theory is good or is a strange theory.
Yes, we have some sentences from our audience. So Alexandro was my colleague during the CS course in 2017, and
Ciao,
he's sending
Alessandro. Ciao, Alessandro.
he's sending a message for you. Well, we are going to our last 9 minutes, so I will ask you my final question, and if the audience have some question, now it's the time, because we are talking with Michele Romano, that is the developer of CS approach. So we have many students and physiotherapists here in Brazil interested in CS approach. Do you have plans to come back to Brazil and teach more and more professionals to how to treat adequately our patients?
Dear Isis, my dear Isis, you know, I think you know that Brazil is one of my favorite countries. So I have no plan for the next future. I have no plan because I have many commitments in many other countries. But my really dream is to come back in Brazil, to return in Brazil, because my previous experience and also the possibility to talk with the Brazilian people for me is not only the possibility to teach, but also the possibility to increase my knowledge, to learn from the people that I can I can see during this course. And in Brazil, typically, my experience was always very good, very nice. So I really would like to return in Brazil. My real plan for the future is to form local teacher also in Brazil, because my dream is to return in Brazil, but sometimes is difficult to organize. I think will be easier if some peoples in Brazil, and you will be, in my idea, you will be the first
I'm glad.
first colleague in my idea, in my concept, to teach this technique. I would like to come.
Okay.
I would like to come. I want to come. I hope to come. But we will work on also to prepare you and other peoples to do this.
Yeah. Okay. Thank you so much for this opportunity. I really love the CS approach because the reasoning is perfect for me. And I am working exclusively with patients with scoliosis since I did the CS course. And I really love to do that. So it will be a pleasure to do this. Even we really will be lucky to have you here in Brazil again.
Thank you very much. Thank you very much. Okay. We must to organize.
Yes, we must organize. And when you come back to Brazil, you will go to the south, where I live, to eat churrasco. That is our favorite food.
Yes. I am waiting this. I'm waiting.
Okay, okay.
Yeah.
Michele, thank you so much for your participation here, for sharing your knowledge with us, for talk about the importance to follow the guidelines, to understand what is the real function of SOSORT and why it is important to follow the recommendation of a big and consolidated society at SOSORT. And we are hoping to see you soon, virtually or presentially, after this.
Virtually, I am here, and I really hope to see you not virtually, in presence with you. And I hope to see you and to hug you soon, very soon.
Yes, so thank you so much. I will speak a little bit in Portuguese, so hang on, we have 4 minutes.
Ok.
Gente, então esse é o maravilhoso Michele Romano, que compartilhou humildemente todo o conhecimento dele. Eu não sei se ficou claro para todo mundo que ele é uma das referências do tratamento conservador da escoliose. Ele já foi presidente da SOSORT, ele inventou o CIAS, né? Ele desenvolveu o CIAS e não só desenvolveu, mas fez toda a parte científica de testar o método, de fazer isso com uma amostra, né, representativa da população de pacientes que a gente trata. E hoje o CIAS está aí com o seu nível de evidência reconhecido, disponível para que a gente possa tratar adequadamente os nossos pacientes. Então, realmente é muitíssimo importante esse momento que a gente acabou de ter. E lembrando que amanhã a gente vai ter live com a Alessandra Negrini e no domingo com a Andrea Lebel para seguir falando sobre a fisioterapia, sobre a importância do Junho Verde, certo? Michele, thank you so much one more time. I really appreciate your speech. Thank you so much.
Very much. Good evening for you. Good night for me.
Thank you. Good night for you.
Thank you. See you soon. See you soon.
See you soon, Michele. Ciao. Have
Ciao.
a good night.
Thank
Ciao.
Ciao, Isis. Ciao, Brasil.
Ciao.
Ciao, Brasil.
Missão cumprida com sucesso. Alessandra, see you tomorrow. Gente, amanhã, então, eu vou conversar com a Alessandra Negrini. A gente vai falar sobre um tema muitíssimo relevante e até pouco falado, porém a gente tem muita curiosidade sobre isso, que é a relação entre os esportes e a escoliose e toda a evidência científica por trás disso. Então, afinal de contas, o que paciente com escoliose pode, o que paciente com escoliose não pode fazer. Isso é muitíssimo importante, não só para as famílias e para os pacientes, mas também para os profissionais que têm que saber recomendar adequadamente. E a Alessandra é uma grande pesquisadora, ela vai nos falar um pouco sobre isso. Vai falar sobre o trabalho dela, que foi o vencedor do congresso da SOSORT o ano passado, que foi uma pesquisa com uma amostra enorme de pacientes que usavam colete, alguns praticavam atividade física, outros não. E aí ela vai nos dizer qual é a diferença entre quem faz atividades físicas e esportes e quem não faz no tratamento da escoliose. Então vai estar muito legal, vai estar tão especial quanto essa conversa que eu tive com o Michele, que foi um momento precioso para a fisioterapia e para o tratamento da escoliose, não só aqui no Brasil, mas no mundo, porque ele é uma referência internacional. E a nossa high level of lives vai seguir amanhã com a Alessandra Negrini e no domingo eu vou falar com a Andrea Lebel. Quem ainda não conhece ela, então vai poder conhecer as duas, né? Para conversar sobre isso. Preparem as perguntas, vocês estão muito tímidos, gente. Tem que perguntar, tem que aproveitar essa oportunidade. Vejo vocês amanhã às 5 horas na nossa próxima live com a Alessandra aqui no perfil da Linear. Tchau, muito obrigada pela participação, pela presença aí de todos.